Assalamualaikum warahmatullahi wabarakatuh. First, let me introduce myself. My name is Nisrina Syifa Ayunindya from Faculty of Medicine, Sultan Agung Islamic University. In this occasion, I will convey you about Consort checklist of an article. The title is Outcome with Intragastric Balloon Therapy in BMI less than 35 Non-Morbid Obesity in 10-year Follow-up Study of an RCD. Okay, let's get started.
Okay, let's get started. In Consort checklist, there are 25 points. The topic that we identify, there are title and abstract, introduction, methods, result, discussion, and other information. This title of article is Outcome with Intragastric Balloon Therapy in BMI less than 35 Non-Morbid Obesity in 10-year Follow-up Study of an RCT. In this article, we will identify sort by paragraph because not all articles contain 25 of checklists. First is checklist number 1A, identification as a randomized trial in the title. That is shown by RCD in this title, that means is randomized control trial. Next is 1B. The checklist of 1B is structured summary of trial design, method, result, and conclusion. That they show by purpose, material and method, result, conclusion that contained in abstract. And then 2A. The checklist is scientific background and explanation of rationale. It shows by this background of this research is in Asia, that Asia has not escaped this global trend, with almost a third of the population classified as overweight or obese in some regions. The increase in prevalence in China over the last 20 years has been 400% compared with 20% in Australia. The prevalence of non-alcoholic fatty liver disease in Asia has grown to around 25%. Next is 2B. The checklist is specific objective or hypothesis in section introduction. That this study is present outcome with long-term follow-up of this RCT to evaluate the long-term efficacy of IGB. Next is 3A. The checklist is description of trial design such as parallel, factorial, including allocation ratio. This checklist is shown by a prospective double-blind randomized controlled trial or RCT conducted in 2006 until 2008 with patients randomized to 6-month IGB therapy or oral sibutramine therapy with some endoscopy. Next is 3B. The checklist is important change to method after trial commencement such as eligibility criteria with reason. But in this article doesn't contain this checklist. So next is checklist number 5. The checklist is intervention for each group with sufficient details to allow replication, including how and when they were actually administered. Patient in the IGB arm underwent placement of Orbea IGB filling with 500 ml and placebo pill for single 6-month period. Sibutramine arm received diagnostic endoscopy and recommend at 10 mg sibutramine daily for 4 weeks and then 15 mg daily for a total duration of 6 months only. Next is 4A. The checklist is eligibility criteria for participants. This contains inclusion and exclusion. Inclusion criteria were patient age 18 until 60 years with BMI 27 until 35, agreeing to undergo invasive weight reduction therapy and intensive follow-up. Meanwhile, the exclusion criteria were patients with coronary heart disease, controlled hypertension, unstable cerebrovascular or cardiovascular disease, renal disease, liver disease, diabetes mellitus, eating disorder, psychiatric illness, pregnant, or breastfeeding. Next is 6A. The checklist of 6A is completely defined, pre-specified primary and secondary outcome measures including how and when they were assessed. This show by primary outcome were change in weight report as total body weight loss and change in BMI. Next, maybe I will explain the checklist number 11A. That 11A checklist is if the who was blind after assignment to intervention, for example, participant, care providers, those assessing outcomes, and how. This show by initial phase, a prospective double-blind and randomized controlled trial or RCT conduct in 2006 until 2008 with patient randomized to 6-month IGB therapy or oral sibutramine therapy with endoscopy. And this paragraph is also contained checklist number 14A, that the checklist is that defining the periods of recruitment and follow-up. They show by the sentence that patient in the IGB filling with 500 ml and placebo for a single 6-month period. And sibutramine arm received diagnosis endoscopy and recommend at 10 mg sibutramine daily for 4 weeks and then 15 mg daily for a total duration of 6 months only. And this patient underwent sibutramine therapy beyond of 6 months. Next is I will explain checklist number 11B. The point of 11B is if relevant description of the similarity of intervention. So in 11A is on this paragraph and 11B is in the paragraph that show by the sentence is multidisciplinary lifestyle modification advice is provided to both groups. All patients receive education on a balanced hypocaloric diet. All patients were encouraged to achieve target physical activity of at least moderate activity such as walking, jogging, or cycling for at least 30 minutes daily for 5 days or week. Next is checklist number 6A. The point of 6A is completely defined specify primary and secondary outcome measures including how and when they were assessed. The first primary outcome is change in weight and change in BMI, and the secondary outcomes were development of new diabetes mellitus and others comorbidity and patient willingness for further intervention. Next is checklist number 12A. The point of 12A is methods for additional analysis such as subgroup analysis and adjust analysis. The statistical analysis were performed using IBM SPSS Statisfy for Windows version 25. Continuous variable were present as mean, standard deviation, and categorical data as number, and comparative analysis performed by test, square, two-way repeat measure, and Mann-Whitney U-test were appropriate. Next checklist is 13A. The point of checklist in the 13A is for each group, the number of participants who were randomly assigned, received intent treatment, and were analyzed for the primary outcome. It shows by this sentence there were no statistically significant difference in sex or initial BMI between groups. There were no difference in comorbidity, sleep apnea, hyperlipidemia, arthralgia, and systolic and diastolic blood pressure. Next checklist is 13B. The point of checklist in 13B is for each group, loss and exclusion after the randomization together with reason. The sentence is follow-up review at 10 years was deemed inappropriate for 2 patients that underwent laparoscopic sleeve gastrectomy and 2 patients that developed advanced malignancy. Next is 14. Checklist number 14. B, the checklist is on the result of requirement that's defining in the period of requirement and follow-up. But in this article, it doesn't include this checklist. And in this paragraph is include checklist number 16, that the point of checklist number 16 is for each group, number of participants included in each analysis, and whether the analysis was by original assigned. That this article doesn't contain of this checklist too. And then checklist is 15A. This 15A, the point is table of showing baseline demographic and clinical characteristics for each group. In this table is contained the demographic of patient in this research, the sex, age, BMI, comorbidity, systolic blood pressure, and diastolic blood pressure. And then for the checklist, number 17 and 18 doesn't show in this article. So the checklist next is 21. 21 is generalizability. The point is external validity, applicability of the trial finding. But in this article information is not given. Next is checklist number 22. The point of checklist number 22 is interpretation consistent with result, balancing benefit and harms, and considering other relevant evidence. The potential benefit of IGB before bariatric metabolic surgery, even as a preparative adjunct to bariatric surgery in class 3 obesity population, have varied result and remain controversial. It also recognized that this association should not be interpreted as a causal relationship. Next checklist is number 20, that the point is trial limitation, addressing source and of potential bias, imprecision, and if relevant multiplicity of analysis. That the sentence is small patient numbers due to the sample size requirement of the initial study recruitment protocol and the response rate despite the long-term nature of the follow-up are notable limitations. Next is checklist number 22. The point of 22 is interpretation consistent with result, balancing benefit and harms, and considering other relevant evidence. It shows by it recognized that the limitation of sample size make interpretation of result difficult. Although a limitation, the short-term 6-month use of sibutramine is doubtful to result in long-term effect to make this patient unsuitable as a control group. That's all of Consort checklist in this article. That the title of outcome with integristic balloon therapy in BMI less than 35 non-morbid obesity in 10-year follow-up study of an RCD.
Okay, that's all I can say. I'm so sorry if there are many mistakes in my explanation. And thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.